Hello again. Now we know where to position our brackets and it's time to do it. Protocol for direct bonding is as follows. You are cleaning the teeth, isolating them with Optragate. You can use NOLA or something else. If I am using bands, I try in the bands, I leave them there, then I bond the brackets. I do enamel etch, bonding agent, bracket placement like your composite, and then I remove and prepare the bands for bonding. I bond the bands with composite or glass ionomer cement, and I clean the excess of material around the bands before complete curing. After this, I clean the excess of bonding material around brackets. You will see, since I changed to Ortho Connect adhesive system, I changed a little bit the protocol and I'm not using any more bonding agent, and I'm doing the cleaning of the excess around brackets in the second appointment when a patient comes for activation. So we need Profimate, but be very careful when you're cleaning not to harm the gingival margins, because blood is not going to help us in adhesion. Also we need tweezers for brackets and for tubes. I use a pusher tucker instrument. I use the pusher part. It is very small and I use it for pressing on the tubes. I use always two consultation mirrors, a probe. You will need etching gel, composite, bonding if you're still using it, and Optragate for isolation. Also we are going to need brackets, positioner or gauge, and the curing light. At this moment there are curing lights with high intensity that are reducing curing time, but in my office this type of light works very nice because my assistant is doing the curing while I load my bracket with composite. You will see. And of course you need a patient. This patient has a different surface for adhesion. So for example we have 1-1, it's an Emax. Also it is very helpful to have OPG on display for better axis control. So while we are bonding we can see the tooth axis on OPG. So the steps are, you apply phosphoric acid for 30 seconds. Ideally is to apply exactly as the bracket sizes and position, but it is not that easy. Second premolar was not etched because it's going to be extracted. Then rinse and dry. After it's dried, if you're still using bonding resin, apply bonding and remove the excess gently with air and light cure it for 10 seconds. And as I was saying, while my assistant is light curing the bonding, I load my tube or the bracket with composite. And after that I apply the bracket to the tooth surface and press gently. After the bracket is on the tooth surface, I take my pusher for the tubes, for example, and push hard the tubes in order to remove all excess composite under the bracket. And for bracket I am using a probe. After this we need to adjust the bracket position and clean excess material and light cure it. You will see that I always use a mirror, a second mirror, to take a look on the bracket position from other angle than buccal. So the mirror check it's very important. It is crucial for the bracket to be in correct position, and a view from other perspective can be clarifying if we have some doubts. It is important to be in the long axis of the crown, so use the OPG and the marginal ridges for guidance. Also, when possible, use direct view, but this is not always easy because it means to move around the patient a bit. Sometimes, when position is unclear due to neighboring teeth, I am covering them with the tip of fingers and create an isolated view. Then I will see only the tooth that I'm interested in. Also, the gauge for vertical assessment can be used for positioning in reference to gingival zenith as well as from the tip of the cusp. Sometimes we are bonding in reference to the gingival zenith, not always on the length of the crown. Also, the probe can be used to clarify and to verify the angulation and mesiodistal position of the bracket. Conditioning ceramic crown. It is advised to respect the procedure indication of the producer. We discussed adhesion in a previous part, so I will not go into this. After etching ceramic, you need a sealant. There are different types of sealant. Let it stay for 10 seconds or as producers recommend. And as I was saying, I'm using a Surplus for bonding to other surfaces than enamel. So apply a Surplus, remove excess and light cure, and after that just go with the usual steps. In this case I used silicone molds for bite ramps, and usually I'm using silicone molds for bite ramps, but there are other options on market. You can use any of them, it's okay. So this would be the situation at the end of the bonding procedure. You can see the patient with all teeth bonded, and you can see second premolar 1.5, it's without brackets, it's going to be extracted. And the bands, this case didn't have bands, but I will show you some pictures with the bands. I usually use bands when TPA or some palatal system is going to be used. Well, after the bands come from lab, please disinfect them and then try in the bands. Prior to day of the bonding, it is recommended to apply elastic separators between contact points and to create more space for the bands. For this we need separator pliers and elastic separators, and we will apply elastic separators in contact points. Correct adaptation of bands. Bands should have a proper height on the crown, and they should be positioned correctly without inclination. Usual and possible mistakes are a mesiodistal tip or bucolingual tip, or some rotation that can occur due to incorrect band placement. Bands should be well adapted and they should sit in perfect position. For band cementation, compomers are used or glass ionomer. And after everything is placed, I usually use to clean excess material with piezo scaler. But now, since I started using GC Ortho Connect, I remove excess material on first appointment for activation. It gives time for animal to remineralize because I'm not using any more bonding agent. So this is the reason why I choose to change to GC Ortho Connect. Special thanks to my friend Cenk that has very beautiful photos, and this is a photo of GC Ortho Connect on the day of bonding. You see there is no primer, there is just etching, and then we have Ortho Connect. And on the next appointment you can see the tooth surface is really clean. There is nothing on it that should present retention for plaque. If you look on other type of adhesive that uses bonding primer, tooth surface looks porous and is more susceptible to plaque accumulation. And my friend Dr. Mazoryov is going to speak about digital system, and he will then present his etching guide that I think that in combination with GC Ortho Connect adhesive is going to revolutionize bracket bonding. Also, I switched to GC Ortho Connect because at removal you can detect it by black light and thus making removal really easy. So this is on direct bonding protocol, and in the next part we are going to discuss a little bit of indirect bonding.